I am Dr. N.K. Venkatramana, neurosurgeon, Brains Super Speciality Hospital. Spine is aligned with a series of bones starting from the neck all the way down to the sacrum. There is a series of bones sitting one over the other, aligned with the spine, beautiful joints, and the joints are held together from upper bone to the lower one by the ligaments, and there is a canal inside which hosts the spinal cord, that is the continuation of the brain, and the nerve roots exists between the two bones and reaches to the particular target in the body. It is a beautiful structure, very complex structure, and so it has got bones, ligaments, muscles, joints, discs, nerves, blood vessels. So all these structures have to be maintained all through the body. Of course, there are age related changes that happen. Regardless of that, the spine is a very complex structure by development itself, because if you look at the structure of the cervical spine, the neck bones are different and compared to the middle part of the spine called thoracic spine, and the lower ones, lumbar spine, the bones are very thick and larger, and the sacrum is a fixed bone. Now the first two vertebrae of the cervical spine we call as atlas and axis. They are completely different in architecture compared to the rest of it. Why such a beautiful design has been given is only because to provide the beautiful movement, since we have assumed the vertical position from a horizontal position from our ancestors, we are able to turn the neck around and look up and down. So to accommodate all these movements, to give flexibility, and these bones are designed in such a way. Now when such a complex design is going on during the development of the before birth itself, a variety of damages or defects can happen during the development. So we call this as congenital defects. Now a part of the vertebrae can be missing, so it is called as absent vertebra, and sometimes one half of the vertebrae is developed, other is not developed, is called hemivertebrae. And if there are multiple of such things, then the spine takes a bend because the load is shifted to one side, it takes a deformity. When it is bent to sidewards, it is called scoliosis. When it is bent forward or backward, it is called kyphosis. And similarly, depending upon the bend, and there can be deformity of the spine. Spine has a particular curvature. If all the bones are aligned, all the joints are perfect, then it takes its shape. If there is any defect in either the bone or in the ligament, it takes a abnormal shape and giving you back an abnormal shape. Whenever you see a person with an abnormal bent body or a sidewards or backwards or forwards, and that means there is a deformity of the spine. So most often these deformities are due to birth. This is called congenital deformities. Some of them can happen later on, either due to injury or due to an inflammatory disease like an ankylosing spondylosis, rheumatoid arthritis, etc. So these defects have to be identified early, and we need to follow it up. If it is a progressive deformity, that needs to be corrected. Otherwise, individual's body shape, the height, mobility, stability, everything will get affected. Apart from that, there can be pain and also can be neurological compression causing weakness of the hand or leg. In addition to that, if the thoracic spine is affected, it also reduces the lung cage, because if there is a deformity of the spine, the ribs will get crowded and the lung can become lung cage becomes narrow. So the lung capacity, breathing capacity, oxygenation of the body, all of them can get affected because of the spine problem. So it is very important that we identify right at the childhood if there is a spinal defect that need to be identified and corrected. Similarly, a child with a neck tilt, that means there is a problem, and the child is always looking to a side, that means there is a defect in the cervical spine. There is a situation where they are playing, and whenever sudden movement of the neck, the child will fall down because of the transient weakness and recovers. These are the ways we can identify if there is a congenital defect.